recording is in progress.
The progression of the recording has begun. All right. Okay. Welcome to the Drilled with Dr. Brady podcast.
Season 2.
Season 2, episode 4? 4?
Quattro.
Wow. Okay. Well, this is just me and Lowell today. We want to bring a series of episodes that feature me and Lowell, maybe like once a month, we're thinking. Isn't that what we kind of talked about?
Yeah, like once a month.
And the thing we're going to talk about today is going to be something that I hope is useful to people who are trying to understand, certain aspects of dentistry, certain procedures, why they're done, why they're told to get them done. What happens if you don't get them done? What are the consequences of that? So we want to kind of divide dentistry into some categories here that are kind of pretty common.
Ask me the question, Brady. I have the answer.
Ask me no questions, and I will tell you no lies.
I have the answer. I did my research, buddy.
Me and Lowell are tired tonight, so
super duper tired. Yeah,
we'll see how this goes. No, I want to help people understand root canals.
Well, Brady,
couple little minutes here. We're going to talk about root canals.
According to the American Association of Endodontists, a root canal is defined as a root canal treatment is designed to eliminate bacteria from the infected root canal, prevent reinfection of the tooth, and save the natural tooth. When one undergoes a root canal, the inflamed or infected pulp is removed from the inside of the tooth, and it is carefully cleaned and disinfected, then filled and sealed.
I think that's a wrap. I think we can wrap the whole
We're done.
up.
See you guys. Great show, Brady. See you later.
How could you have any questions? That's clear as mud right there. Jeez. Yeah. So I think a lot of people assume a lot of stuff about root canals. Here's some interesting things I hear on a very regular basis. I hear, so if I got a root canal, doesn't that mean that my root's gone? I don't know why people think that. That's a really weird thing to say.
This is general, like people just have a general lack of understanding of what's actually going on, because I mean, it's not like you get to see the dentist do something. They're just literally doing
That's
it
true.
In your mouth.
That's true. It's very common. People have
hurt.
Multiple root canals done in your mouth, and you still have no idea what a root canal is. But yeah, the purpose of the root canal is to remove the tissue that lives inside your tooth, or that lived inside your tooth, because the tissue could be dead as well. Could be dead and necrotic, or in other words, rotting inside your head. And you don't even know.
The worst root canal I've ever had was one of the ones that you gave me. But to be fair, you warned me it was going to suck because it was super infected, and you're like, this is really going to suck. You gave me a fair warning.
I usually give people a fair warning when it's super infected. Yeah. That's a problem too. When you wait for things to be infected, everything sucks worse. It's funny because sometimes I get people who are like, oh, all my dental visits, like I don't get numb very well. People say that a lot. I don't get numb very well. And when you start really like scratching at the surface of that, what you find out is that they only come to the dentist when things are infected. And so it makes them think that they don't get numb very well, but in fact they do, but no one gets numb very well when the tooth's infected. So if all your visits are only when there's infected teeth, then you would come to the conclusion wrongly that I don't respond well, or I have a high resistance to anesthetic, which is not necessarily the case. You just never get your teeth worked on when they're healthy.
Take it from someone that knows.
When they are diseased and broken and decaying out of your head.
I had plenty of dental visits where it was only fire. It was only putting out fires. Like literally there was a fire and we had a fire sale and it had to be done. And I've had plenty of dental visits like that, but take it from someone who's had a lot of dental visits.
Yeah.
Bad and good. When you're not infected, the dental visit really is not that bad. That's like, even if you're getting like something major done, like you're getting a crown, or maybe you're even getting a root canal, maybe it's not infected yet. It just needs it done. It's actually, that's when a root canal is actually pretty just easy going. It's like you're a little sore and that's it.
Yeah. So what you do with the root canal, what the actual procedure is there's these tiny little drills that go into the tooth. Now, some teeth have a single root and some teeth have multiple roots. But however many roots there are, there's usually that many canals, hence the word root canal. And so you have to go in with these little drills and find all the canals and empty out or clean out all the living tissue. And what that leaves behind is a hollow husk of a shell of a tooth, and a hollow shell of a man to boot. So then it's filled with a bacteriostatic material, typically, meaning a material that is resistant to future infections. The material is called gutta percha, which is a rubber-based material. It's a weird name, right?
I like it. It's kind of a beat you can dance to.
If I ever start a band with all dentists, I think I would name the band Gutta Percha.
Or maybe you should start a band with like all dudes in professions that are not necessarily well understood, or
like accountants and lawyers and dentists,
like chiropractors,
yeah,
any kind of thing that someone would consider a snake oil salesman,
and then call the band Real Doctors.
Or not so real doctors. That'd be fun,
right?
The spin doctors.
Accept us, please. We are real.
We do stuff.
Yeah. So I think, and tell me if I'm wrong, this is why it's nice to have Lowell, a non-dentist, let's call him an honorary dentist. He's not able to practice legally, but
legally doesn't.
He knows a thing or two about dentistry.
I know enough to be dangerous.
So I think it's easy to explain what the procedure is. I think that's easy for people to wrap their head around. I think it's difficult to understand sometimes why you need it. A lot of people, it becomes obvious if okay, so first reason why you might need a root canal is if the nerve becomes exposed. So that inner hollow chamber of the tooth is like this gummy bear. It's like this mushy, we call it a pulp chamber because it's all pulpy. And the nerve is like this little wormy looking goober thing. And inside the tooth, there are three things. There's a nerve, there's an artery, and there's a vein. So you got a blood supply and nerve supply inside every single tooth. That's all living tissue. That's all attached to the rest of your body. Anything blood supply, so nerves go to your brain, blood supply to your heart and everywhere else in your body. So everything's connected. So when that tissue becomes infected or exposed to the outside oral environment or your mouth, first of all, hurts usually really bad. And second, any bacteria that gets in your body that way could go anywhere into your rest of your body.
I had to explain this to one of our Halo patients. We had a severe. She works for a doctor's office, right?
Okay.
And I've never had as much trouble with like paperwork to get one of our Halo cases to us with their job. Like I've never even had to like talk to the job. This was the first time. But like when I approached
I remember you telling me this. Yeah,
I had to explain this to them because they did not see this as a necessary medical procedure. I'm not going to name names, but just say this very nice lady needed a lot of things done. It was a wreck. Mm-hmm. It was just a bacteria fest waiting to happen.
Yeah,
and I had to explain to them that the mouth is a direct avenue to the bloodstream, to the respiratory system, and to the nervous system. If you have just put your doctor brain on for a minute. If you have a big giant infection right in your mouth, it's connected to all those systems. It can go to all those systems very easily. So why wouldn't that be like a health concern that would warrant, like a few days off after the procedure?
Right. Yeah. No, that's good. It's a good point.
I wrote a letter.
So I think one of the major questions I get is, and one of the hardest things to explain is when I know I'm about to enter into a conversation with someone about, I'm about to tell this person that they need a root canal and nothing is hurting them. And that gets really difficult to explain. And there's a couple reasons for that. So a lot of people say, hey, you need a root canal. You're like, dude, I don't feel anything. I don't see any problem. Like, what do you mean? First of all, if you're the patient in this situation, you should feel entitled to ask some questions. So you should feel entitled to be like, can you explain to me? I always thought root canals were associated with pain and I'm not feeling any pain. What's the danger? That's a very reasonable question. You should get a very reasonable answer if your dentist, is shooting you straight.
Give us a reasonable answer, Dr. Brady.
There are two main reasons why you might, well, there might be a few more, but there are two main reasons that come to mind about why you might need a root canal, but you don't know you need a root canal. So one of the most common reasons is you have a hole in your tooth, a cavity, decay that is very, very deep, but not quite to the center of the tooth. But it's so close that you cannot remove the decay without punching in to the nerve of the tooth. So that would expose the nerve. And any exposure of the nerve typically results in the need for removal of all the tissue inside the tooth. And that's what a root canal is. So if you got this decay right on top of your tooth, and I'm looking at the x-ray and I'm looking at your mouth and I'm thinking, I got to remove all this decay, I'm fairly certain by removing the decay, that will tip the scales. Now, if you were to just fill it, you'd have a patient coming back that night, like in excruciating pain. If you expose the nerve and try to patch it over with a filling, that would be painful, and you would be praying and wishing that you would have had the root canal done, because the filling will not be permanent treatment for that tooth. So that's one situation where you may not feel pain, but still the scale is tipped against you. The other situation, this happens a lot with front teeth, especially in kids who like knock their front teeth, like trauma that can sever the blood supply to the tooth. So have you ever seen someone with like a dark front tooth?
Yeah, my stepdad had one for a really long time. Like
Yeah.
it was visibly like it was this guy, and it was visibly like darker than the rest of them.
So typically what that means is that there's a necrotic tissue inside the tooth. So what happens when you fall off your bike or someone punches you in the face? What it does is it kind of like pushes on the tooth and it pinches or severs the blood supply or the nerve supply to the tooth. So you got to think of like teeth as little sprinkler heads, right? And there's a little line, a water line that goes into each little root. Okay. So if you take the tooth and you kind of move it forcefully, traumatically, what you're going to do is you're going to sever that sprinkler line.
It's like kinking a hose. It's like kinking a hose.
It's like kinking a hose permanently. So what you have now is a severed line. Now you have one tooth that has all this mushy stuff in the tooth, in the pulp chamber, but it's no longer connected to the body. It's been severed. So now that connection from the vein and artery above the tooth going into the tooth is no longer there. So it no longer receives blood supply. It's no longer actually part of your circulatory system or nervous system. So the tissue in there just dies. And when the tissue dies, the tissue inside turns black.
And you get butt breath.
And you get the butt breath. Yep. And then you smell like you eat the butts. And that's no good.
Make you very popular in Portland.
Yeah. Amongst the Gen Z population.
I've been working a long time today.
Right.
But
so you got a dead tooth or you eat butt.
Dr. Brady, according to holistic dentist drdavidhoward.com.au.
Oh no.
On the internet. I did a general internet search and this is what came up. Just general. I'm not worried about talking about this dude because literally it was the top hit. Like he pays for that. So it's fair game. Why I encourage you to think twice before getting a root canal. He starts, and then he says, please don't let your dentist mislead you. That a root canal is your only option, or that it is entirely safe. Teeth are similar to any other organ system in your body, and in that they do require a blood supply, lymphatic and venous drainage, and nervous innervations. Mm-hmm. Root canals, however, are dead teeth. These dead teeth typically become, if not the worst, sources of chronic pain, bacterial toxicity in your body. He's still not selling me on why you don't need a root canal yet. Like it's like,
Well, they like to say dead teeth. That's kind of scary.
if your kidney or liver or any other organ in your body dies, you would have it removed so that the bacteria and the necrosis will not set in and kill you. But teeth are commonly left dead in your body. Okay, I see where he's getting with this. Teeth have roots with main canals and thousands of side canals, and contained in those side canals is miles of nerves. When dentists perform a root canal, they remove the nerve from the main canals. However, they do not have access to the microscopic side canals, which have dead nerves left behind in those spaces.
Yeah.
It's just a litany of.
So he's not wrong. Let me put this in layman's terms.
It says dead tooth 6 more times. I counted.
So what he's saying is that there's microscopic portions of that nerve that are still left inside the tooth. And he's probably right that you can't completely remove. Now, this is a rabbit hole. This is a conspiracy theory akin to
the moon landing.
Did we land on the moon? Yeah, which obviously we didn't. Is the Earth really round? We don't know. Is COVID real? Who knows, man, at this point?
Easy boy.
Who knows?
Simmer down.
Let's get people angry. Yeah, so we're bouncing a little bit all over the place. So I guess let's get into holistics, because the holistic group is a very small portion of the population of dentists that there's a little bit of a range. There's holistic dentists that will get really aggressive, and any tooth that has been root canal ever, they will diagnose to remove it, regardless of your symptoms. Could be completely asymptomatic, and they say it's been root canal. There's dead tissue inside there. We know that that's a fact. We got to remove it because it causes toxicity. And that term toxicity is a scary term, but
unless it's a System of a Down album.
Oh, hey. Now I'm thinking of System of Down songs. That's all I'm thinking about.
Yeah, but what I'm saying is, like, the only reason I brought that up is, like, you hear a lot of naysaying about root canals.
Well, okay, this is a good point, because what you have here is a failure to communicate, right?
Mic drop. Get out of here.
No, because dentists should know. You said this was the second hit.
Yeah, it was right near the top. Like, I just typed in why not to get a root canal.
You had why not to get a root canal?
Yeah, because I wanted to be kind of balanced in this argument. You know what I mean?
I think that's a term that some people who are looking to get root canals or looking to not get root canals. And let's be honest, who wants a root canal? Freaking nobody, right? So it's good for dentists to know what, like, I love Googling stuff like this, to know, like, if my patients are Googling it, what do they see, so that I am prepared if I don't agree with that assessment. So this guy's the number 2 hit. And if this is what you're looking for, then yeah. Now, here's the truth is, there are alternatives to root canals. You could pull the tooth out and put a dental implant in there, replace the tooth. You can pull the tooth out and not replace the tooth. That's less advisable. All right. But there are alternatives to root canals, and they're not, this holistic dude is not wrong about that. You know, the way I see holistic dentistry, and here's any aspect of dentistry, and this is what the problem with our profession is, that, and Lowell has gotten a front row seat right outside the octagon of dentistry, because there's so much infighting that, like, people just like, oh, you're a PPO office or a fee-for-service office. It's like, oh my gosh, these people go.
Let's be real though. It's not an octagon. It's literally a wrestling ring. And I've been known to throw a chair in every once.
There's a mud pit. There's a mud pit in there.
It's you're basically wrestling in cream corn.
Yeah, pretty much. But the holistic guys aren't wrong in that. And they're not wrong in saying that you can't possibly know that you're getting 100%, like, down to, you know, every little molecule or microbe out of that tooth. It's very difficult to know that. Now, we put a lot of medicine inside the tooth that kills, like, little liquid. We use a product called sodium hypochlorite. It's like a diluted bleach, goes into the tooth. and it kills a lot of stuff. A lot of people use ozone therapy, which goes into the tooth, and that kills a lot of stuff.
Wouldn't that more than likely seep into like the microscopic little side canals?
Presumably, but the
Presumably.
holistic person's going to say, well, you don't know that for sure. And I'm going to say, you're correct. I don't know that for sure. I don't know that for sure. Where I think they get off is that, okay, then they jump to a conclusion where they say, if there is a dead tissue, then that has harmful effects on your body. And I don't know. The problem I have was you have millions and millions and millions of people who get root canals done, who don't exhibit any crazy symptoms.
Yeah, look at me. I've had a bunch of them and I'm fine. Like
Basically, yeah. Now again, the conspiracy theory, this goes down. Now, what's interesting, there was a movie on Netflix called Root Cause, and it got pulled off of Netflix a few years ago. It wasn't on Netflix for very long. I watched it, and we were told not to watch it. There were like notices going out from like the ADA, like encouraging dentists not to watch this. So of course I'm like, well, I'm definitely watching it because I want to know what people are. Listen, that's my curiosity. I want to know what people are saying. If they have arguments, I want to hear what they have to say. This whole documentary on Netflix followed this the director of the documentary was also like the star of the documentary. He had a tooth that needed a root canal. He got a root canal done. He has all this, paints this picture of this terrible things that happened to him. And then he got the tooth pulled out, and all of his problems went away. And there's like they quote studies where like weird stuff where they take like infected teeth and they put it under the skin of rabbits, and then the rabbits like contract all kinds of deadly diseases and die.
That's the dumbest thing.
Well, that's what I think. I'm like, yeah, you're putting freaking.
If you stick a foreign organic object under the skin of any creature, it's gonna get an infection.
Right. Like, let's go backwards. Let's take rabbit teeth out and shove them under your skin. Let's see what that. Let's see what that does. Let's see if that doesn't.
Like a good Tuesday night for me.
Yeah, exactly.
Basically, my takeaway from this, though, like, is just like we'll say quasi lay person. Actually, that's probably false. I'm definitely beyond a lay person at this point. But my takeaway is this: like, if as a consumer, is that if I was at a dental office and the dentist told me something that maybe I didn't understand, I didn't like, I didn't, had some kind of principle that it violated, man, shop around. Don't avoid the procedure. Just shop around until you'll find a dentist that's like, you are like, okay, cool. I believe what you say. It fits my set of principles, and let's do this. But if you leave these rotten things in your face and not unchecked, uncared for, I've done it. I've rode out a gnarly tooth for way too long, and it just makes your life miserable.
Yeah, no, that's a really solid piece of advice. I think that not a lot of people follow is get second, third, fourth opinions. Make sure you trust the person that you're talking to. That's a huge thing. A lot of people choose their dentist by like whoever's in their network, whoever's geographically close to them. But ask friends, who's your dentist? Do you like your dentist? Figure things out. And why do you like your dentist? But these are hard things to do. The psychology of this also is like, dude, it does not take a lot of convincing to get people off the root canal train, right? It does, because it's such like I don't want a punch in the face. Here's an article about why punches in the faces are bad. So I'm not going to get a punch in the face and that's how people view root canals. It's like, yeah, I don't want that. So any information that tells you how these are bad and terrible, it's easy to like have that be like a confirmation bias to you about your already kind of preconceived notions. Like, I don't want to get a root canal, so I'm going to go look for information that confirms that I don't want to get a root canal. So it's like a self-fulfilling prophecy, right?
If you're going to do this, though, you should definitely it's in this age of misinformation, and it's really hard to get a line, like a bead on the truth. It is. And any subject, pick any subject randomly, and it's hard to get a bead on the truth. So you just kind of got to go with what feels right for you, but don't put it off. That's all I'm saying. Like, find somebody, if your mechanic told you that your radiator was depressed and needed therapy, you might want to find another mechanic.
Right.
That's what I'm saying.
Or give your radiator some Prozac.
Yeah, just dump some in there. It's fine. I
Just
got
dump
some
some
lying
Prozac in
around.
there, makes you feel better. So another question you get sometimes is, okay, I had my root canal done, but my tooth still hurts. How is that possible? That's a pretty frequent question. There's two things that could be, well, at least two things that could be going on there. I got my root canal done. It's still painful. First of all, what you want to know is how long afterwards, because sometimes it's painful just because having a root canal done is kind of like having like a surgery on a tooth. And if you had surgery anywhere, you would expect incision pain, right?
I've had
Where you have the
plenty of
incision,
that.
yeah, it would be tender, inflamed. So the ligament that surrounds the tooth tends to get temporarily inflamed after a root canal. Not always. Sometimes people get root canals done, they feel nothing. Sometimes people get root canals done, they get a little tender, like a little, they feel like a little heartbeat in their tooth for a day or two.
I've
Something
had
like
both.
that.
I've had both where some
And
were just nothing. And then like that one that we talked about earlier, that particularly nasty root canal that I had done. Uh
mhm,
that one actually lingered for a bit. It
yeah.
eventually, after a week, I think it was like a week or so, it went away. But for a week, man, that thing was pretty tender.
Yeah. So in that situation, you would want to wait a little bit if it was just like right after the root canal was done. But then let's say it doesn't go away and it lingers. And let's say it's, sensitive to hot and cold. Well, hot and cold is typically like a nerve thing, not an inflammation thing. So that wouldn't be caused by like incision pain or like post-surgery pain. So if you are sensitive to hot and cold, that usually means there's still a sizable enough portion of the nerve that's still kind of connected to the brain. Sometimes that means that a canal was missed. So that could be a reason why, is that it wasn't thoroughly done. That could be, which would be operator error, which your dentist would have to, finish it or refer that out to a specialist to finish. That would get frustrating. That's a frustrating conversation to have for sure. And then the idea is, what if it's been years? Um, and then it starts to get achy. Well, you still have nerves. The common misconception is there's no nerves in the tooth, so teeth can't hurt. That's not exactly true. There's nerves inside the ligaments that surround the teeth. So you can still have a traumatic injury to a tooth that causes a chronic inflammation, and it causes your tooth to hurt, especially when you bite on it. So you bite on a tooth that's chronically inflamed because let's say you got punched or hit, even after a root canal was done, even years after, that traumatic injury could potentially trigger the tooth to cause some pain symptoms. And you might have to remove the tooth and get an implant in that situation. So, but typically root canals do get you out of pain, but there are situations where pain can return. And again, you should talk to a dentist that you trust to find out which reason why. But there are some things that go on. A lot of people just say my tooth's been root canal. I don't understand why it's hurting. So I hope that kind of makes some sense.
I have I have a tooth that and it's not pain. I have a tooth that I had root canal, but it's like one of the bottom teeth, and I have like the bottom teeth are kind of straight, but then there's one that's just like one wonky guy that just kind of hanging in the back. Now we did a root canal and put a cap on it. I still feel pressure, and it makes it feel like there's like a little bit of pain, but it's because it's not
Hmm.
that tooth. It's because it's wedged between two other ones, and I think it's the other two just kind of like maybe I'll tap it, or maybe you know how your teeth will shift ever so
Yeah.
slightly. I think they maybe just shift a little bit and put some pressure on it. It's
Yeah,
not bad. I'm
we
just
should update
aware
we
of it.
should update your exercise. Have we cleaned your teeth in a long time? When's the last time? We should clean your teeth. We should get you
Uh,
in.
yeah, I want Lauren to do it. I like when she cleans my teeth. They feel sheepy shiny. And I do need to get a tooth cleaning. I'm a little bit overdue. Just a
Have the
little
tooth
bit.
docs. They'll clean your teeth. They'll clean your teeth
Just a
for you.
little bit overdue.
Lauren's great. She's great.
She gets old
Um,
school with it. She gets real old
so
school with
listen,
it.
if you're listening to this, and I tried to think about all the questions I get on a regular basis. Oh, cost. Should we talk about cost of root canals?
Yeah, I mean, people are going to wonder.
Because I was just about to say, if you're watching the YouTube, so you can email questions to drilledpodcast@gmail.com. If you're on the YouTube watching this, just put your questions in the comments, and we might be able to do like an edit where
We
we answer
go
some
through it all
questions.
the time too. We go through
Yeah.
the
So
comments
if you
pretty
have
regularly.
questions and something that wasn't covered that is burning in your brain, let us know what those questions are in the YouTube comments. But cost. Okay. So first of all, it's going to be everywhere. Okay.
It's gonna be all
I
over that.
charge $850 for a root canal. Now, I do some unique things that most of my profession doesn't do. I just charge $850 for a root canal, no matter which tooth it is. But traditionally, most dental offices will have a different price for, they have three different tiers of pricing. One is for an incisor or a canine. The second tier is a little more expensive, is for a premolar. And then the third tier is a molar. Now, there's some justification that I agree with, is that that gets difficult. The degree of difficulty goes up as you do go from anterior to posterior in the mouth. It's harder to do a premolar than an incisor. It's harder to do a molar than a premolar. There's also, the molars are way far in the back, so it's harder to get to, so the access is harder. So it is justifiable and traditionally done to charge different prices for root canals. The reason I don't charge a different price for a root canal is because I don't like to explain that to patients. I think it's a sore spot for patients when you're like, how much is, so people call and they say, how much is a root canal? That's a common phone call you get. How much is a root canal? And I hate to say it depends, because I love giving patients an answer. People call with an answer, I want to give them an answer. So I just decided to say, just say 850. 850. That's my price for a root canal. So when I do a molar, maybe I could have charged 1200, but I didn't. But also if I do an anterior tooth, like an incisor, maybe I could have charged 600, but I charge 850. So I split it down the center and do 850 for everything.
And that's good business too. This
Yeah.
is good business. Someone calls you, and instead of being like, well, I don't know, it's just like 850.
It just simplifies, for me, it just simplifies things. And I
think
don't
it
mind doing,
simplifies it for your customer too. I think it simplifies it for your patients too, because it's just like, here
Right.
it is. Here it is. Take it or leave it. See ya.
but
You know,
when
like,
insurance is involved, there are different prices for different teeth. That's absolutely true. So insurance pays different. Insurance pays me more for a molar than they do for an anterior tooth. So yeah. Now, other people's prices. It depends on where you are geographically. And now this is an area where I wish I could give people more information, more solid information. But you will have to call your dentist, ask your dentist, and it's difficult to call a dentist up sometimes and try to get like a straight, like, how much is this going to cost me? If you are going to call a dentist and ask that question, you should know which tooth it is. If you know the tooth number, that's even better. If you at least know it's a molar, premolar, or an anterior tooth, that's helpful too, because that actually helps them get, if you give them that information, they should be able to give you a set price. But still, a lot of doctors don't like to give their price out over the phone, probably because of sticker shock. I love to give my price out over the phone because I know my price is better than everybody's. So I don't have to worry about them going anywhere else. Once they find out what the price is other places, they'll come to me. So that's my genius. That's my super smart method.
For those listening, I know Brady won't plug himself, but I've got no qualms about plugging Brady. Brady is the dentist I send all of my friends, family, wife. Like, they're like, oh, if I even see him, be like, oh, I'll be like, dude, what are you talking about? I know a guy. Just go see the man. Like, they're like, we figure it out. You'll figure it out. He's very reasonable. You'll figure it out.
Mostly reasonable. If I've had a good meal, I'm very reasonable.
Yeah, but in January, when you decide to intermittently fast again,
yeah,
it's a miserable month
Dr.
for
Brady
yours
no
truly. It's a miserable month for me too.
Yeah, it's a real thing. So then between dentists and specialists, there's different costs too. That's what's interesting too. So specialists, I would say a general dentist, a root canal is going to cost you probably between $1,000 and $1,200, maybe between 800 and let's say between 800 and 1,200 bucks. After a root canal, though, you do have to get a crown. That's another question too. Why do I have to get a crown after a root canal? Talk about that in a second. But a specialist is probably going to be minimum 1,500 bucks for a root canal, probably between $1,500 and $2,000 for a root canal. So there's just a wide variety. Well, the other question is, why do specialists exist? What is a root canal specialist? We call them endodontists. They go to like 2 years of schooling more on top of dental school. You might wonder, why would someone want to do that? And I would say, I don't know. You have to ask them. That makes no sense to me. I don't have any clue why they do what they do. But they do charge a premium because they're a specialist. And that's all they do, and they're very good. They usually have microscopes. and fun little gadgets that make their job easier.
Think about it this way too. That's any profession. Anytime someone has gone above and beyond or done some kind of excellent level of training, you're gonna pay more for that. That's like when I do guitar repairs. I was a luthier's apprentice for 4 years, like a dude, like a well-known luthier. So it's like I can feel justified in charging more when I do something because I can guarantee you it's going to be done right. Like,
Yeah,
because I've trained to do it, over the course
yeah,
of several years.
and specialists are great, and that's why they're there. So lots of dentists. Root canals are not something you get a lot of exposure to in dental school typically. Most dental students don't come out of dental school. I came out of dental school, for example, having done 3 root canals total. And then I got let loose on the public. Then they let me in. They released me into the wild to work on people. So, and I had done 3. So if you were my 4th root canal, you were my first root canal. Like in private practice. My first root canal in private practice was my 4th total ever. So that's kind of crazy. What was the other question I had? And then I went off on the specialist chart. So fees are like, yeah, they're all over the place. But you should be able to ask that if you have the right number. If you know the number of the tooth, that should be. You can go on the internet and figure that out. There was a question it was like a few minutes ago.
Well, we were talking mainly about like costs.
Yeah.
What it costs, but the fact that it costs over the
board.
board.
Why you need a crown? That's what it was.
Yep.
Why do you need a crown after you have a root canal? So this is really applicable to almost every single situation in the posterior mouth, meaning like premolars and molars. Almost every time you need a crown. There are situations where anterior teeth don't really need crowns because there's not that much pressure being put on them. But a root canal weakens your tooth. 100% true. Without the blood supply and the nerve supply, the living tissue inside the tooth, your tooth will desiccate over time. It'll dry out. It'll become brittle.
That's a good word.
So, yeah. So you will put yourself at risk of breaking that tooth if you do not crown it. That is not just something dentists say to make themselves more money, although it does make us more money. But it is absolutely necessary to salvage the tooth. The last thing you want is to pay all that money for a root canal, go through the whole procedure, and you bite down on a sandwich 2 years later, and you break the tooth in half, and now you have to have it pulled out and put an implant in. And because I can promise you, no, I'm super reasonable with giving money back to people for things that don't work. My policy in my office is to give people their money back if things don't work. But I will not give money back in a situation where someone had a root canal done and never crowned it. That is a situation where I would say, nope, I do not give a guarantee on any of my work unless you crown the tooth post-root canal. Got to have it crowned. So the crown strengthens it and makes it viable for decades, and prevents the tooth from cracking or breaking.
I mean, just think about it. If you hollow something out and then you fill it with something, and the outside of the structure is compromised, like severely compromised, what's the one thing you want to do? You want to build up the outside of the structure so that it doesn't break. Basically, you're armoring your teeth at that point. You're armoring the wound so it can heal properly and it won't be damaged by like eating rocks or whatever you eat in your free time that breaks your teeth.
Yeah. I just saw this clip on, what was it? Was it TikTok? I think I shared it on my Instagram stories about a lady who is addicted to eating rocks.
That's a thing. I've seen.
She just eats rocks, dude. I couldn't even believe it. So just picture this lady. She's just chomping on rocks. She just picks up rocks and eats them.
How are her teeth?
They can't be good. It can't be good.
If dude. They are, but we should maybe take some notes.
Oh man, that's crazy. So if your dentist says get a crown on your tooth, they're probably shooting you straight. But if you feel that they're not, follow Lowell's advice and get a second opinion.
That's not even my advice. That's Brady's advice that I'm just repeating. He said it before, but yeah, just get a different opinion.
Yeah, I mean, I told a patient today. I had a patient encounter today where like I wanted to do the work to help him out, but for some reason I didn't convey the confidence necessary for this patient to pull the trigger on what I was saying they needed. And they told me that they wanted to get a second opinion. And I said, that's great. If I were you, that's exactly what I would want to do too. I want to get a second opinion. Here's my price. Here's what I can do for you. If you want to come back, you are most welcome to come back. Call us back whenever you'd like. If you have questions for me, I'm here to help you out. And that's it. And you let that bird leave the nest and you wait for them to come back. And in my case, I see him come back a lot. So yeah. Anyways, we won't get into my business model philosophy, because I don't, that's what people are here for. It could be another podcast. But that's root canals in a nutshell. I hope that's helpful.
I think we've explored both sides of the argument. I think we've been fair about both sides of the argument.
I hope this is something that gets searched on YouTube a lot and people find helpful. So if you found this helpful, that would be cool to put it in the comments on YouTube, because now we video. So for those listening to the podcast, we video these now, and I have like special lighting, which is why
not nearly as cool as mine.
Lowell's lighting is really cool.
Well, we had band practice here not 10 minutes before we started this, so I just left the stage lights on.
Nice. I like it. But I hope that that's beneficial. So hopefully people are like, out there looking for information on root canals. I just think it's really confusing. I've Googled root canals all over the place. I've seen what's on YouTube, but it can be kind of confusing. And I see the looks on people's faces when they're coming to my practice, and they're like, I don't know what you're even talking about. So anyways, hope that's helpful. I think that's all I got, Lowell.
I'm super. I've been wearing the sunglasses so you can't see how tired I am.
All right. If I left anything out, please email us. Let us know you have questions. We do want to help you, so we'll catalog all your questions and maybe edit things up, or maybe do special Instagram lives at some point to handle all this stuff and try to answer everybody's questions.
You're going to see a lot more videos coming from us from season 2 of the Drilled Podcast. So hang on.
Okay, good stuff. All right, let's over and out this till next week. Peace out.